Hi, my name is Daniela Maldonado and I'm going to talk about Koilonychia in iron deficiency anemia. Definition: the Koilonychia is a disorder of the nails, generally of the hand, in which these are abnormally thin and being able to be flat or even concave. This can be a sign of hypochromic anemia, especially anemia due to iron deficiency, and is associated with Plummer-Vinson syndrome.
Koilonychia is a change in the character of the nail plate, usually a concavity in the nail, and is indicative of something, again, systemic, but more specifically, oxygen content of the blood going to the toenail. So we think in terms of lung infections, emphysema, some type of problem with the lungs that doesn't oxygenate the blood enough to cause the most distal part of our body to grow properly. Koilonychia, cupping in the nail. And the same thing with club nails, where the nail changes to the opposite position, because the nail is starved for oxygen. I think if you see a change on the nail plate to that degree, whether it's clubbing or Koilonychia, I think it probably does relate to a more systemic disease. I would start with your family doctor first, then maybe a dermatologist, then get a general physical exam to look to the part of the body that might be causing it. The reason that the nail shows lots of different pathologies is because the nail is very sensitive to oxygen content. And oxygen content comes from the blood. And blood is oxygenated at the level of the lungs. So most of these changes we see in the nail plate most likely are associated with lung-type diseases. But I don't know that I would run directly to a pulmonologist. I would see your family doctor, follow up with a dermatologist, and then be referred to a pulmonologist. But I think it is a serious disease.
Applications in medicine. Known which groups of people are more predisposed to suffer from iron deficiency anemia. These are premenopausal, pregnant, and people of low socioeconomic status, elderly, etc. Inform about a correct diet, indicating that foods are rich in iron. Inform on diagnostic tests to establish the cause of the anemia. Determination of hemoglobin and erythrocyte count to assess the response of the treatment, and emphasize compliance with diet and pharmacological treatment.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to be doing an NCLEX review over iron deficiency anemia. This video is part of an NCLEX review series over hematology. So what I'm going to be doing in this video is I'm going to be covering what iron deficiency anemia is, the patho, the causes, the signs and symptoms, and the nursing interventions, and giving you some mnemonics on how to remember some of this material. So let's get started. First, let's start out talking about what is the definition of iron deficiency anemia. This is a type of anemia that is caused by low iron levels. So the big thing with this is that we have anemia going on because we don't have enough iron in the body. But what is anemia? Anemia is the decreased amount of red blood cells or hemoglobin in the body. And these components play a huge role in carrying oxygen throughout your body. So if you do not have enough of this, you are going to be experiencing your tissues and organs are going to be deprived of oxygen. And later on, depending on how severe this is, you'll start showing signs and symptoms of it. So before we dive into the patho, let's talk about the key points we need to remember about this disease that's going on. Okay, this iron deficiency anemia is the most common type of anemia. There's various forms which I will be covering, but this is the most common type. The body uses iron to make hemoglobin. So without iron, you won't have enough hemoglobin. And low iron levels lead the body to produce fewer red blood cells, which leads to less hemoglobin. And hence your body will receive less oxygen, which here in a second you're going to see why, the reasoning behind this in the patho part. Now, at first, the signs and symptoms of iron deficiency anemia are vague. The patient probably won't know what's going on. They may just feel a little fatigued, but as it gets worse and worse because they're not treating it, it will progress where they become more noticeable. And iron deficiency anemia is usually diagnosed. The patient will go in, talk about this. The doctor may order a CBC, a complete blood count, which they'll look at the red blood cells and the hemoglobin level, hematocrit levels, see if those are normal. May order an iron level because remember, iron plays a huge role in making hemoglobin. Or they may do a blood smear test where they will take and look under a microscope at the red blood cells and look at their appearance because they will have a specific appearance in iron deficiency anemia. And treatment for this condition will be diet changes, putting more iron in the diet, in iron-rich foods, iron supplementation with medication, and how to prevent this. Okay.
In the pros and cons, we have that the pros are that normally the treatment for iron deficiency anemia involves replacing the loss of iron from the body, and the doctor will prescribe an iron supplement to replace the loss of iron. And in the cons, we have that most symptoms of iron deficiency are due to anemia. These symptoms are tiredness, loss of resistance, dyspnea, weakness, dizziness, and pallor. In addition to the usual manifestations of anemia, pronounced iron deficiency causes some infrequent symptoms.
Iron deficiency anemia. The best treatment options. Iron deficiency anemia, also spelled iron deficiency anemia, HELP 1, is anemia caused by not enough iron. Anemia is defined as a decrease in the amount of red blood cells, RBCs, or hemoglobin in the blood. When anemia comes on slowly, the symptoms are often vague and may include feeling tired, weakness, shortness of breath, or poor ability to exercise. Anemia that comes on quickly often has greater symptoms, which may include confusion, feeling like one is going to pass out, and increased thirst. There needs to be significant anemia before a person becomes noticeably pale. There may be additional symptoms depending on the underlying cause. It is caused by insufficient dietary intake and absorption of iron, or iron loss from bleeding. Bleeding can be from a range of sources such as the intestinal, uterine, or urinary tract. The most common cause of iron deficiency anemia in children in developing countries is parasitic worms. Worms cause intestinal bleeding, which is not always noticeable in feces, and is especially damaging to children. Malaria, hookworms, and vitamin A deficiency contribute to anemia during pregnancy in most underdeveloped countries. In women over 50 years old, the most common cause of iron deficiency anemia is chronic gastrointestinal bleeding from non-parasitic causes, such as gastric ulcers, duodenal ulcers, or gastrointestinal cancer.
Iron deficiency anemia is among the 10 leading causes of morbidity and mortality, causing 1 million deaths per year. Classified as a public health problem with a global prevalence of 40% and 30% for Latin America, where Ecuador ranks third with 37%. Infants are at an increased risk of anemia due to imbalance of accelerated growth and low iron intake. Anemia occurs during the first 24 months of life, crucial moment of development and cerebral differentiation. The damage may be irreversible, and the constant updating in prevention, diagnosis, and treatment. The Koilonychia usually appears by an iron deficit. People suffering from iron deficiency anemia may have this condition. However, there are other causes that could cause it, such as hereditary or congenital.